We can do better than that for the senator, can't we? Can we do better than that for the senator? Good afternoon, Florence. It's kind of warm out here, but it's a good day because we have in our midst this afternoon the next president of the United States of America. I say so because of what Senator Sanders has stood for, what he has represented, and what he is doing and what he proposed to do in the future once he becomes President of the United States. We can make that happen here in South Carolina for the senator, because the senator believes that everyone should have health care, no matter who you are, what level of income that you might have. Health care is a human right. Senator Sanders believes that no child should leave college in debt. No matter what income level you might be. Senator Sanders believes that $15 an hour is not radical. And those are just a few of the things that Senator Sanders stands for. But more importantly in my mind, Senator Sanders is concerned about the least of these. He is concerned about those who have not the 1%ers who owns and operates almost 80% of the monies in this country. He's concerned about those who don't have enough food to eat. He's concerned about those who have to decide whether or not they're going to get their medicine or starve. In this country, home of the brave, land of the free, we can do better. We will do better. We will do better when we elect Senator Bernie Sanders as the next president of the United States. So I'm grateful to be a part of this team. I'm grateful to be a part of a team of a person who cares about the least. Hear me out now. Who cares about the least of these. And that's why I am with Senator Sanders. Because he cares about the downtrodden, those who do not have. And again, we welcome you here. We welcome Senator Sanders here, and we welcome here to Florence, and we're going to have a good time this evening listening to others, and particularly the next president of these United States of America. Welcome, all of you, this evening.
Please welcome to the stage the Mayor of Florence, Stephen Wakila.
Good afternoon. It is great to be here. It's great to be at the Francis Marion Performing Arts Center. Isn't this a beautiful place? You know, the PAC has just done wonderful things. We almost didn't get Senator Sanders here, though, because, you know, he's sworn off PACs completely. But we had to convince him that this is a different kind of PAC. You know, I was asked to speak here today about Medicare for All. And there are lots of reasons, innumerable reasons, why Medicare for All makes sense as a policy choice. Now, we can talk about why it should be the right of every American citizen to have, about how it's immoral to have the wealthiest country in the history of the world have citizens that die from treatable illnesses because they can't have health care. But that's not what I'm here to talk about today. Today, I want to talk about money. I want to talk about money, and in particular, I want to talk about profit. Now, think about this. Medicare for All can expand coverage, and it can reduce cost by simply eliminating profit from the equation. The massive profits that are made by the healthcare industry, AM Best reports that in 2018, just through the third quarter, the insurance industry, the healthcare insurance industry, made over $25 billion in profit. In profit. 25 billion with a B. And that's through the third quarter. That didn't make it all the way through the year for them. That's up 20% over last year, and it continues to grow. Now, how do you make profit if you're a healthcare? Well, it ain't complicated. It's not rocket science. You spend out in claims less than you collect in premiums. You spend less than you get. And so how do you do that? You increase premiums. You increase deductibles. You decrease claims payments. You only insure the healthiest among us. And that, of course, is precisely what we have in this country right now. Millions of uninsured Americans, premiums and healthcare costs that are double per capita what they are in every other industrialized country in the world. That's the situation we have. The remedy is to take those $25 billion worth of profit and instead apply that to coverage, apply that to paying claims. The federal government does not need to make a profit. Now, unsurprisingly, the healthcare industry and their lackeys are opposed to that. I wonder why. They have 25 billion reasons to be opposed to that. And so what do they tell us? They tell us government's inefficient. They tell us that it's anti-competitive. It's un-American. They tell us you're a socialist if you believe in Medicare. Well, you know, under President Obama, when we were debating the Affordable Care Act and we were debating the public option, and we said that people should have an opportunity to buy into a public option, to buy into Medicare, the insurance industry opposed that. Why? Because they didn't want to compete with an inefficient government. And why didn't they want to compete with inefficient government? Because the government doesn't have to generate $25 billion of profit every year to pay their wealthy shareholders. That's what we have right now, and we can remedy that problem by going after the money, going after the profit, and funding health care for everybody in this country the way they do in every other industrialized country in the world. There is one candidate who has been talking about Medicare for all for years. There is one candidate that's been out there beating that drum, and now there are more and more, aren't there? As there should be. That candidate is Bernie Sanders. That's why I support him. He'll be here today, and I hope you'll support him as well. Thank you.
Please welcome Dr. Sasha Federer.
Good afternoon, ladies and gentlemen. And let me just introduce how I fit in all this. I was for about 22 years director of psychology for Carolina Hospital, so I've seen it close and personal. And last 16, 17 years, I worked with probation, so I've seen people who come out of prison. And it becomes clear that quality of healthcare depends on how it's available. Can you get it? If you cannot get it, doesn't matter how wonderful it is. If it's not achievable for you, if it's not accessible to you, it doesn't exist. You know, 95 is a stroke belt, and Florence County is the buckle on the stroke belt. We have more strokes than anybody else in the world. The problem is people start stroking out at 50, and second problem is Medicare starts at 65. So if you have a stroke, and if you don't have insurance, you have no rehab. And if you have no rehab, you don't recover, and you stay as you are right after the stroke. And even though it's possible to rehab strokes, if the rehab is not available, then there is no help. The second thing that I see is the largest mental health facilities in this country are prisons. And that's where most of the mentally ill end up, or many of them. And when they come out, if there is not assistance for them, they have difficulties fitting back in. And so when there is not availability of money and mental health treatment, then you end up with a variety of issues. One of them, for instance, is people who start with depression are much more likely to seek some kind of a relief and become addicted to a variety of addictions, from pain pills to any sorts of drugs that starts often as a depression that has not been treated. And I have seen work in a hospital, people who have to decide, do I buy meds or do I pay the electric bill? And I think also for us guys, we are we are self-neglecting. So for a lot of men, if it's not accessible easily, we don't go to a doctor. And we go and we neglect ourselves. And maybe that's why married men live 3 years longer than single men, because we have wiped out and said, go to a doctor. But if there is no doctor to go to because you cannot afford it, then you end up with health deficiency and fewer productive years in your life. And but on a personal note, I have a daughter who was in between jobs. And yesterday, she fell and shattered her elbow. Today, she had a surgery. And tomorrow, because she doesn't have insurance, she will be in a poorhouse, or I will. And that is what happens when there is no accessibility of mental health or health care. And that's why I believe that the universal health care is a way to go. And when you talk to people who are coming close to 65 or are 65, the sigh of relief when you finally get on Medicare and all the worries about being able to afford health care are over. That's maybe the only thing that's good about aging, that when you hit 65, you can go on Medicare. So considering that is a possibility, I think that we need to consider universal health care. Thank you.
Coming to the stage all the way from California, Congressman Ro Khanna.
Thank you. It's great to be in Florence. And what a great turnout. I want to thank Mayor Ukela for welcoming us. How many of you saw any of the Democratic debates? Raise your hand. Now, here's the thing in those debates. There are a lot of candidates who have a self-interest in obfuscating and making Medicare for all to sound far more complicated than it actually is. Medicare for all is actually one of the simplest ideas. It's simple because it's good policy, and good policy, like the truth, tends to be simple. How many folks here think they have a good idea about what Medicare for all means? Good. By the end of it, I want everyone to remember 4 things about Medicare for all. Just 4 simple things that when people come with all these lies, we're going to push back with these facts. Medicare for all means more benefits, less costs, everybody's covered, and more jobs. Let me go through all 4 very quickly. More coverage. Senator Sanders' plan means that people on Medicare are going to now get dental coverage. They're going to get vision covered. They're going to get their hearing covered. They're going to get long-term care covered. That's the fact. It's going to mean better coverage for anyone who's on Medicare and for every single person. How many people here know someone who has been in the hospital too long and then they start getting bills? Have you known someone? I mean, it's crazy. There was someone who contacted my office You know, after 90 days, how much you have to pay for a hospital stay under current Medicare? $682 a day. How many people here can afford $682 a day in a hospital? If you don't want that, you're for Bernie Sanders' plan. Because Bernie Sanders' plan means if you get on Medicare and you go to the hospital, you're not going to be charged $682 a day. So that's more benefits, less cost. Let me just be very clear about this. The average family of four, any guesses on how much we're paying for the average family of four with health care today? $28,000. $28,000. From the family, some of it comes from the employer, from the family itself, $12,000 out of your pockets. Guess what that goes down to under Bernie Sanders' plan? Any guesses? Zero. Zero. So more benefits, less cost, everybody's covered. How do you know this? Because under Bernie Sanders' plan, you get Medicare the day you are born. No more fighting with insurance companies. And here's the final point, which really, you know, I feel like throwing something at the TV when I hear these candidates. How many of you, they say, oh, it's going to cost us jobs. It's going to close rural hospitals. That is just a lie. It's a lie. You know why it's a lie? Because what is the plan going to do? Think about it. It's going to get more people on Medicare for all. That means more people are going to have revenue. That means we're going to need more doctors, more nurses, more people in the healthcare industry. It's going to create millions of new jobs. And it's going to fund rural hospitals so that the hospitals actually have resources. So why is it, if Medicare for all is going to mean more benefits, less costs, everyone covered, and more jobs, why is it that so many people are opposed to it? I'll tell you why it is. Because Aetna's CEO makes $58 million a year. Because hospital CEOs are making $6 million a year. Because pharmaceutical CEOs are making tens of millions of dollars a year. They're the ones who are launching attack ads of millions of dollars against Senator Sanders. This is not a debate about policy. This is a debate about whether we are going to stand up for ordinary people in this country or we're going to stand with special interests. The senator has the courage to stand for a policy that we've known is true since the time of Lyndon Johnson. And let me end with this. Next time a candidate says, oh, Senator Sanders, you're so radical, you're so out there, how can you have Medicare for all? I want us to tell them, would you have said that to Lyndon Johnson? Because Lyndon Johnson wanted Medicare for all. Would you have said that to Daniel Patrick Moynihan? Because when we had in 1994 all those hearings, if you remember, with Secretary Clinton and the health care plan, 25 hearings Daniel Patrick Moynihan had. Probably the smartest senator. I mean, Senator Sanders is pretty smart, but Moynihan was very, very smart. One of the smartest senators. And he said, at the end of the 25 hearings, he said, all of this is really complex. The only thing that makes sense in this country is Medicare for all. That was 1994. Today is 2019. I'll tell you the difference in this race. There may be different people who now claim to be for Medicare for all. There's only one person who, as President of the United States, will deliver Medicare for all, fulfill Lyndon Johnson's dream, and fight for health care justice. That is Bernie Sanders, the next President of the United States. Thank you.
Please welcome our national co-chair, Senator Nina Turner.
Florence. Wow, every speaker before me, but Rep kind of did that, didn't he? He kept it simple. And so what this thing is about is really weaved into what Congresswoman Barbara Jordan once said, and she said these words, what the people want is very simple. They want an America as good as its promise, and that's all we're talking about. And what my colleague just laid out is there's a difference between somebody who's on the side of the people solidly and somebody who want to play games. Somebody who understands that the needs of the workaday people in this country is more important than those who can buy off Congress members, and they don't. The difference between somebody who goes to fundraisers and hobnobs with the ultra-wealthy and to tell them in their living rooms that nothing will fundamentally change for multimillionaires and billionaires. Well, if nothing fundamentally changes for multimillionaires and billionaires, then nothing fundamentally changes for you and 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 all that you love. So only all that we love is on the line. Now, we had the doctor, he laid it out about what is necessary in this country to have Medicare for all, to ensure that we stop commodifying health care in the United States of America. It is the difference between corporate-run health care or public-run health care. Those are the two differences. And anybody who says something different, they wrong. And this is about building on the ACA, not taking from the ACA. This is about labor unions being able to negotiate for wages and work conditions instead of having to negotiate within that negotiation on their health care. We are not going to let folks separate union workers from non-union workers. We are all in this together. All in this together. So as Rep. Conda laid out, it's easy. And it is the same position that the Reverend Dr. Martin Luther King Jr. was in when he analyzed the healthcare system in this country. He talked about of all of the injustices or all of the inequities that he has seen in this country, the injustices in the healthcare system by far is the worst. So now we have a champion who will not equivocate on what it means to stand up for the working poor and the barely middle class in this country. We got that champion, and his name is Senator Bernard Sanders. And you know what the beautiful thing is, Florence? He's not new to this. For every bad thing that was happening in this country, if you go back and roll the tape, there was Mayor Sanders, there was Congressman Sanders, there's Senator Sanders, and next it will be President Sanders standing up for the people. And you know what? I mean, I want us to have this debate. I want to roll the tape. I'm glad there's going to be 10 folks on this stage. I wish it was more on the stage. Let's have them juxtaposition Senator Bernie Sanders with anybody else on that stage. We win every time because he doesn't go for what's popular. He doesn't go for what's in the polls. He goes what is in the best interest of the people, and that is Medicare for all. That is college for all. That is canceling student debt. That is lifting up the people in this country from all walks of life. That's how the senator rolls all day long. So I want to have this debate. And it is a beautiful thing, as my colleague just said, that so many people have seen the light. Beautiful thing. But we don't have to go with the copies, baby, when we got the original, and his name is Bernie Sanders. We ain't got to have no copies. We go with the original. The one who doesn't have to answer to his owners. I'm sorry, the donor class. Because he started this thing in 2016 when he ran for president. He said, you know what I'm going to do? I'm going to run a campaign based on the donations of the people. And he showed that it can be done. Every single presidential candidate should be running a race that way so that they don't have to answer to the donor class. So, Florence, if somebody tells you that we dreaming too big and reaching too high, if anybody tells you to accept anything less than Medicare for all, or college for all, or canceling student debt. We were asked to bail out Wall Street, and we did that. Now it's time to give some love to Main Street, and that is what Senator Bernie Sanders stands for. This is about our willingness to do it. We are the wealthiest nation on the face of the earth, and if we have the will to do it, it can be done. But let me tell you something, Florence. Folks are not just going to roll over in Wall Street and the pharmaceutical industry and these CEOs of companies. Now, I'm going to say this, because, see, this is not about begrudging people any wealth. We all want some wealth. But what we are sick and tired of is excessive greed on the backs and the necks of the working people of the United States of America. They can't have it all. They can't have it all. Now, who does this? Can I just say, Senator Bernard Sanders has an anti-endorsement list, Florence. I mean, who does this? Very much in the spirit, FDR, judge me by my enemies. In modern terms, we're going to say, judge me by my haters. is the only presidential candidate that has that long of a list of haters because they want to keep things the way that they are. President Nelson Mandela once said, "It always seems impossible until it is done." We can have Medicare for all. We can have college for all. We can cancel student debt. We can make sure that women get their whole damn dollar for once. Come on, sisters. We can protect our reproductive health because we don't need men, ladies, telling us what to do with all of this. We got this. We can make sure in this country that everybody has clean air, clean food, and clean water, and not sell the American people out for the folks who buy off the Congress and the legislatures in this country. It is up to us. It always seems impossible until it is done. So I want you to know this afternoon that Senator Sanders says what he means and he means what he says. He understands that this economy is rigged against the everyday people of this country. He understands that President Donald Trump has done more rigging since he's been in the office. He wanted to talk about clearing out the swamp. Baby, he done brought the swamp monsters all up in that piece. So we're going to fight against a rigged system. Legal, political, economic, social. We got a criminal justice system that sees black and brown and indigenous and poor people as criminals just because they are poor. We are sick and tired of black men and women being gunned down in the United States of America. We're going to fix this system. Oh, it's rigged, baby. We're not going to stand for it. And we got a leader who was asked at an event with faith leaders what he would do about white supremacy. And he said, we're going to war with white supremacy in the United States of America. Oh, yeah, baby, we're going to do this. So, Florence, we need you because all the powers are assembled against this man and his mission because they know that he's going to do what he said he's going to do. He cannot do it alone, and that is where you come in because we need a political revolution in this country to make crooked paths straight. And we are all in this together no matter how we identify. Saving Mother Earth is a human issue, not just for one party or one group of people. We have nothing if we don't save Mother Earth. And sisters and brothers, our mission is so high, we can't get over it. And our mission is so low, we can't get under it. And our mission is so wide, we can't get around it. And we need each and every one of you to show the folks who want to keep the status quo in place that nothing on the face of the earth is more powerful than a conscious-minded people on the move. And we are conscious-minded, and we are on the move. And if we are willing to put a little extra on our ordinary, extraordinary things happen. We can do this. So, Florence, can you do something for a sister? Do you mind doing something for a sister? Can you raise one hand for yourself and one hand for somebody else? Because we all in this together. With these hands, we will have Medicare for all. With these hands, we will have college for all. With these hands, we will cancel student debt. With these hands, we will reform a criminal justice system that is vile. With these hands, we will take care of Mother Earth. With these hands, we will unite for something that is greater and bigger than ourselves. And with these hands, we will elect the people's champion, Senator Bernard Sanders, as the next president of the United States of America, baby. With these hands. With these hands. With these hands. Oh, yeah, we're going to do this.
Fire. Let me thank everybody for coming out on this cool Vermont evening. Let me thank, what do you got these little bugs around here? Please. Let me thank Representative Terry Alexander for doing a great job in the legislature and for his strong support. Let me thank Mayor Stephen Wakila for doing a great job right here in Florence, and I thank him so much for his support. Let me thank Dr. Sasha Federer for doing wonderful service as a psychologist in the community. Let me thank our national co-chair, Ro Khanna, for being one of the progressive and great members of the U.S. House of Representatives. And what can we say about Senator Nina Turner? See, this is a woman who drives me nuts because I got to follow her. And everybody's going to be disappointed in what I say after she goes up here. But Nina has been working hard for years, doing the most important work that we as a nation have got to see done. And that she's gone coast to coast, getting young people and working people and people of color involved in the political process, getting people to stand up and fight for economic justice, for social justice, for racial justice, and for environmental justice. Nina, thank you so much for all that you do. I want to be honest with you and tell you what our campaign is about and to tell you how it really differs from other campaigns. Obviously, I am here in South Carolina to ask for your support to help us win the Democratic primary here. And with your help, we're going to do just that. And we're running around the country to try to win the Democratic nomination, and I am absolutely confident we're going to do that as well. And with your help and with the Democratic nomination, we are going to defeat the most dangerous president in the history of this country. Now, whatever your politics might be, I would hope that we can agree that we don't need a president of the United States who is a pathological liar. We don't need a president of the United States who changes his views every single day on important issues, who makes policy by tweets. We don't need a president of the United States who actually is trying to enrich himself in a corrupt way as president of the United States. You know, you would think that you'd be busy enough being president without having to try to make more money for your real estate company. But apparently that is not the case for Mr. Trump. We do not need a president who is a racist, who is a sexist, who is a homophobe, who is a xenophobe, and who is a religious bigot. And I understand that in South Carolina, I understand that in South Carolina, around this country, people have different points of view, and that's good. That's called democracy. But we do not need a president who is trying to get reelected by dividing us up by the color of our skin or where we were born. Whatever your views may be, what a president is supposed to do is bring us together as Americans. Now, this campaign differs from other campaigns in a very important way. And that is, the message of our campaign is us, not me. And that means two things. Number one, it is an understanding that our view of human life and how we can be work together to solve our common problems. In other words, my job as an American is to worry about your families, and your job is to worry about my families. We are in it together. And our job is not to raise kids who are going to lie, cheat, and steal, and step on other people while they try to make $1 billion. That's not our view of what human life is about. And the second point that I make when we talk about us, not me, is the understanding that no president of the United States, not Bernie Sanders or anybody else, can do it alone. And the reason for that, which you're not going to see discussed on television or in the newspapers very often, is that we have a corporate power structure that is so powerful that no president alone can effectively take them on. They have endless supplies of money, and to a very significant degree, they determine what happens in this country economically and legislatively. And the only way we transform this country is when millions of people come together and stand up and tell the 1% and the corporate elite that this country and our economy belongs to all of us, not just the 1%. And I'm talking about taking on the power of Wall Street. We are talking about taking on the power of the insurance industry, the pharmaceutical industry, the fossil fuel industry, the military-industrial complex, the prison-industrial complex. And that's a lot of power out there. But the last I heard, the 1% may have unlimited amounts of wealth and power, but they are just 1%. 99% is a heck of a lot bigger than just 1%. I want to focus this afternoon on an issue that is maybe an issue of more concern to the American people than any other issue that is out there. And that is the dysfunctionality of our current healthcare system. And I just want to make a couple of points that some in South Carolina may not be aware of. Number one, there is only one major country on earth that does not guarantee health care to all people as a human right, and you are living in that country, and as president, I intend to end that international embarrassment. Number two, the United States of America spends twice as much per person on health care as do the people of any other major country on earth. You got that? That means that we should be having by far the best healthcare system in the world because we're spending so much money. All right? If I bought a car for $50,000 and you bought a car for $25,000, I have every reason to believe that my car is going to be a lot better car than your car. We are spending twice as much as other countries, and yet our health care outcomes in many cases are worse. Today in America, we have 87 million people who are uninsured or are underinsured. Anybody here underinsured with high deductibles and high copayments? That's right. And what that means is when you get sick, if you're uninsured or underinsured, you don't go to the doctor when you should. And if you don't go to the doctor when you should, sometimes you're going to get a lot sicker. In this country, we lose 30,000 people a year who die unnecessarily because they cannot afford to go to the doctor. Today in America, 1 out of 5 Americans cannot afford to fill the prescriptions that their doctors write. 1 out of 5 Americans. I recently went to Canada with some people who were diabetic. We paid 1/10 of the price for insulin as the drug companies are charging us in this country today. Today in America, we have millions and millions of people who do not go to the doctor when they should. We got 500,000 people who go bankrupt every year. You know why they go bankrupt? Because they were diagnosed with cancer or heart disease or Alzheimer's disease, and they could not afford to pay the bills. So I want you all to take a deep breath and think about that. Think about a nation in which we spend twice as much as other countries. 30,000 people die. Millions cannot afford the medicine that they need. But at the end of the day, while this healthcare system is not working for working families, it is working for one group of people. Last year, the healthcare industry made $100 billion in profit. So today we say to the healthcare industry, the insurance companies and the drug companies, that the function of a rational healthcare system is not to make billions for insurance companies and drug companies. It is to provide healthcare to every man, woman, and child as a human right. Now, I have been accused, as the lead author of the Medicare for All bill in the Senate, of trying to disrupt the healthcare system. Nothing can be further from the truth. Here is the facts of what we are trying to do, and you judge whether this is disruptive. Right now, people 65 years of age or older get Medicare. And let me tell you, there are millions of people who are 60, who are 62 right now, who cannot wait to get to be 65 so they can get Medicare. There's one of them right there. More than one, all right? So what we do in the first year of our Medicare for All legislation is pretty simple. First of all, we expand Medicare by covering hearing aids, dental care, and eyeglasses. These are basic health care needs that Medicare today does not cover. We also expand coverage to include home health care. Because right now, you got a lot of people who are older or who are disabled who would rather stay at home rather than go into a nursing home, but they can't get the care that they need to take care of them at home, and we cover that. First year, we also lower the eligibility age of Medicare from 65 to 55. All right, a lot of folks who are 60 would love to get into Medicare. And then we go from 55 to 45 the next year, and then we go from 45 to 35, and then we cover every man, woman, and child in this country. Now, that ain't disruptive. That is a very conservative approach toward universal health care. And I want you all to remember way back in 1965 under Lyndon Baines Johnson, we started Medicare as a public health program. They started it out of nothing, and in the first year, they covered 19 million seniors. If they could do that back in 1965, don't tell me that we cannot, over a 4-year period, cover every man, woman, and child in this country. Of course we can. Now, what does the Medicare for All program mean? So let's be clear. A lot of people throwing out a lot of terms. Everybody's for Medicare for All. In fact, the last poll that I saw here in South Carolina is 90% of people who are going to vote in the Democratic primary are for Medicare for All. So let's be clear about what we mean for Medicare for All, at least what I mean by it. What I mean is something quite similar to what the Canadians now have, and I live 50 miles away from Canada. Anybody know what happens in Canada if you have a heart transplant, major surgery, and if you're in the hospital for a month? How much is your bill when you get out of the hospital? Anyone know? Zero. Canada, you go to any doctor you want. Don't let anybody tell you for a second that under our proposal you don't have freedom of choice with regard to doctors. Under the current system, you may not have freedom of choice because your doctor may be in another network, not under Medicare for all. Any doctor you want, any hospital you want. You do not take out your wallet because there are no deductibles, there are no co-payments, there are no premiums, there are no out-of-pocket expenses. What we do is pay for health care in America, like virtually every other country, out of the general tax base, and we do it in a progressive way so that the vast majority of people who will no longer have to pay a premium. And we're seeing working people in this country paying 15, 20% of their incomes in premiums and out-of-pocket expenses. That's gone. What we will pay for health care is out of the general tax base in a progressive way. The overwhelming majority of Americans, perhaps except the very, very wealthy, will pay less for health care under our plan than they currently pay. Now, for most Americans, that's an idea that makes sense. But I'll tell you one group of people for whom it does not make sense, and that is the healthcare industry that made $100 billion in profit last year. And as we speak, they are spending millions and millions of dollars lying about what a Medicare for all system would do. So, our job is to expose their lies. Our job is to rally the American people with the understanding that health care is a human right. Human right, not a privilege. Nina Turner quoted Nelson Mandela in a very profound statement. What he said in so many words is, everything is impossible until it happens. Everything is impossible until we make it happen. 30 years from now, your kids and your grandchildren will be asking you, was it really true that there were people in America who could not go to the doctor when they wanted to? Was it really true that people went bankrupt because they could not pay their health care bills? And you will have to tell them, yes, it was. But together, we're going to end that obscenity, and we're going to end it in the next few years. And I should also tell you that we are going to take on the pharmaceutical industry, whose greed is causing the lives of people all over this country. We pay by far the highest prices in the world for prescription drugs. Many of you cannot afford the prescription drugs you need, and yet the drug companies made $69 billion in profits last year. Under Medicare for all, nobody in America will pay more than $200 a year for prescription drugs. And the reason we do that is we end the absurdity of allowing the drug companies to charge us any price they want. Right now, you can go into a drugstore and the price of your medicine can double, and that's perfectly legal. We're going to put an end to that greed. So, my friends, the issue that we are talking about is of enormous consequence to this country. The issue that we are talking about will once and for all end a situation where people today are scared to death about getting sick, where millions of people are staying on jobs that they don't like because they have decent health insurance. That's a little bit crazy. People should be able to do any work they want, leave their job, and know that whether they're employed or unemployed or in transition, their family will continue to have health care because all Americans have health care as a right. So, today I'm here in Florence to ask for your help to take on the greed of the insurance industry and of the drug companies and do what the American people want, and that is to guarantee health care to every man, woman, and child in this country as a human right. Thank you all very much. Okay, thank you. Thank you. Thank you. All right, anybody have any questions on healthcare or anything else? We got a mic over here. Yeah. And we got a mic over there. Okay, if you got a question, raise your hands. Any questions? All right, people are too hot to have questions. All right, I see a question right there. Yes, sir.
I wrote it down, so. Last year, the Government Accountability Office reported that medical fraud cost Medicare $50 billion in, obviously in fraud. And even though I think Medicare is a good plan, or your Medicare for All plan is a good plan, it's a necessary one, how will you and your Medicare for All plan tackle the problem of fraud, and how will you address it?
Well, fraud is an issue right now, but I think when we change the nature of our system, let me ask you a question, everybody. And I want you to think about it for a second to answer this gentleman's question. What is the function of the healthcare system today? That's right. All right. The function of the healthcare system today is for the health industry, for the insurance companies to make as much money as they can, for the drug companies to make as much money as they can. And right now, we're looking at lawsuits that states are waging against the pharmaceutical industry in terms of the opioid crisis because they were selling a product that they knew was addictive. And we've seen time after time the pharmaceutical industry involved in collusion and in price fixing. So when you have a system that is motivated by greed and profiteering, that's what you're going to have. When you have a system which is nonprofit, whose function is to provide health care to all, I think the level of fraud will go significantly down, and we're going to monitor that very, very carefully. Thank you for your question.
Senator Sanders, so with regards to health care and how it's going to be paid for, a lot of people, like myself, have an employer-sponsored health care plan where the employer pays the bulk of it, probably pays 85% of my premium. When that gets shifted into a tax on the individual, it seems like that's going to be good for the employer, but it's going to end up putting a bigger portion on me. I'm not sure I'm going to come out better than that. I think not.
I think you will, and I'll tell you why. You're not going to pay, right now, your employer's paying 85%, you're paying 15%. Do you have any deductibles in your plan? How much is your deductible?
$500.
Per what? Per month or per year or what?
Year.
Per year. Okay. And you got co-payments?
Yes.
Okay. And you're paying for prescription drugs?
Yes.
All right. All of that is going to be significantly reduced. You're not going to pay any premium at all. That's gone. You're not going to pay anything more than $200 a year for prescription drugs. You're not going to have any deductibles at all. So you'll be paying more in taxes, but at the end of the day, you'll be paying less than you are paying for health care right now. And to the degree that your employer saves money, especially for union workers, our view is that the workers should benefit from those savings. Okay? I'm sorry?
Well, that's mine too. They're definitely going to have a savings. I don't see that translating into any benefit for me, honestly.
Well, I think you're going to have, I think at the end of the day, you will have a better plan than you have right now. It'll be comprehensive, okay, and no deductibles and no co-payments. I do believe you will be better off. Thank you very much. Okay. Yep.
Sanders, I have a question. How do we handle these past debts? Because I know in South Carolina, for medical, because I know for myself, I'm not covered here because I don't make enough. I literally don't make enough to actually be covered by Obamacare. So I've actually accrued medical debt that is now against me. Is there anything in your plan that would actually work for people that are drowning right now from their medical debt?
Actually, in another piece of legislation, there is. I mean, what we're looking at right now, as I said earlier, is 500,000 people who are going bankrupt and others that are using up their entire life savings to cover the medical bills that they have right now. And I gather that's your scenario. So in another piece of legislation that we're going to be offering, we will eliminate medical debt in this country. I mean, I just stop and think for a second, why should people be placed in financial duress? For what crime did you commit? You had a serious illness? All right. That is not what this country should be about. But I think when we move to Medicare for all, we will end bankruptcy and we will end families having to suffer financially because somebody came down with a serious illness. Thank you.
Senator Sanders, is really an honor.
Let him hold the mic himself and hold it to your mouth. Okay, yeah.
Senator Sanders, it's an honor to be able to witness you speak today. And I have a really simple question. Why isn't anybody considering like the fire department or the police or the library socialists? Why is it only Medicare?
You're right. Throw in public education as well, right? Look, what other countries around the world do is in the sense that they understand that education is a human right. Every kid has the right to go to a public school in America. We understand that when you call the fire department or the police department, nobody asks you how much money you have. They come because that is part of what our society is about. What every other major country on earth understands is that health care has got to be considered in the same way. That health care is a human right, just as police protection, fire protection, and education. So your point is well taken. And the reason that people are opposing us is very simple. It is the greed of the healthcare industry that's making $100 billion a year. They like the current system. They're doing very well under the current system. They want to continue to make huge profits despite the fact that so many of our people can't get to a doctor when they should. Your point is well taken. Okay. Maybe 3 or 4 more. All right, we got 2 people up there, and we got a person back there. Let's take those 3 questions.
Okay. Senator Sanders, in the past couple of years, we have seen the rise of these far-right authoritarian leaders and the effect they have had on the stability of our world, such as in Brazil, where a corrupt investigation has falsely imprisoned their popular and former president, Lula da Silva. How will the Sanders administration address these leaders and their negative impact on our world? Lula livre.
Well, as somebody who has written to Brazilian authorities to get Lula out of jail, it's an issue that I feel very strongly about. And that is the United States needs to conduct a foreign policy based on democracy and human rights, the very opposite of what Trump is doing now as he supports authoritarian governments in Brazil and all over the country. Okay, we'll take those 3 questions right there. Sir.
Florence, it's very exciting. I live in Canada. I came from Canada for better pay and opportunities. I'm a physician. And it's a well-known fact that in the socialized medicine, physicians are paid less than in the private system. How do you intend, and by the way, Canada got drained from physicians coming to the United States 20 years ago. How do you intend to maintain the interest and the pay of physicians so we keep the brightest in that profession?
Actually, that's not accurate. Canada has not been drained, and if you look at how people feel about the Canadian system, including physicians, they are far, far, far more positive about the Canadian system than Americans are about this system. And if you talk about people going across the border, talk about the millions of people who go to Canada for lower-cost prescription drugs because they pay far less in Canada than they do in the United States. So to answer your question, of course we need to pay our physicians well. But that whole issue of physician pay, right now, we have physicians who are not paid well enough. Those are primary care physicians. There are some physicians in some cases who are paid too much. And what we need to do is make sure that in rural America and in urban America, we get the doctors to practice in those areas through various type of incentives. So I don't accept the basis of your question. I think we need in America more doctors. As a matter of fact, we need more nurses, and we need to get them in medically underserved areas. So right now you're seeing in rural areas, hospitals are shutting down. There are counties where there are no doctors. That is not a system that is working well. Sir.
Hello, Senator Sanders. Is it not true that your Wall Street transition financial transactions tax, along with the use of the Federal Reserve System to finance student loans and also to upfront refinance those student loans so you can collect your Wall Street transactions tax, do you think that the Federal Reserve is an issue that a real president like you would be able to responsibly use Franklin Roosevelt's tradition to force industry to finance at reasonable rates to create high-wage jobs?
The short answer is yes.
Yeah.
Okay. I think the Federal Reserve is an entity that we American people know too little about, and it's a very powerful entity. It's got to be used in a way to protect American workers and not just the wealthy and the powerful. All right. One last question, and we have one back there, or that's it? Okay.
Very important question for
Yeah.
you.
Okay, last one. Yeah.
How do you plan on getting the Medicare for All passed a Republican-led Senate?
Well, for a start, it's my intention to do everything I can to make sure that we don't have a Republican-led Senate. But second of all, this is what I think, and it gets to the heart of what our campaign is about. There is nothing that I have discussed today that is particularly radical or that is unpopular. The American people want to raise the minimum wage to $15 an hour. The American people want universal health care. The American people want to make public colleges and universities tuition-free. They want to cancel student debt. They want to deal with climate change. They want real criminal justice reform, real immigration reform. They want to protect the woman's right to control her own body. All right? The real question that we should be asking is, how does it happen that you have a Republican Senate who believes that we should give massive tax breaks to billionaires and then cut Social Security, Medicare, Medicaid, and education? And the answer gets to the fact that you have many members of Congress, Republicans, maybe some Democrats, who are more interested in protecting the needs of their campaign contributors than the working class people of this country. And that has got to change. That's why we're going to overturn Citizens United. That's why, as president, we will put those senators on the spot. You know, I was in Kentucky last week telling the people of Kentucky whether or not they support their Senator Mitch McConnell, who wants tax breaks for billionaires and cuts to essential programs that working families need. So you rally the American people around a progressive agenda, and you put pressure on those members of Congress who would prefer to stand with the rich and the powerful against the needs of working families. And that is what this campaign is about. What this campaign is about is saying that it is time for a political revolution. Okay? It is time to have a president and a Congress that represent the 99%, not the 1%. It is time to raise the minimum wage to $15 an hour and have equal pay for equal work. It is time for health care for all. It is time for us to aggressively address the global climate crisis. It is time for us to make sure that all of our kids have the educational opportunity that they need. These are not radical ideas. These are ideas that the American people support, and our job is to make sure that those ideas are implemented. Thank you all very much.
Stand as a president.